Targeted cancer therapy is a new and very promising approach to the treatment of cancer. It is designing new treatments, new drugs, that specifically target the cancer cell. So they avoid normal cells and go directly to the cancer cell and then cause that cancer cell to die. It includes drugs such as Herceptin, Avastin, and Erbitux. These can be given by themselves or in combination with regular chemotherapy.
He said that this drug would go direct to the cancer in the colon. And I said, well, does it have a GPS or something to, to know where to go? It wasn't a dilly-dally.
He explained it as a smart bomb, which was a great way of explaining it. He said it's going to go in there and it's going to kill every single HER2 positive protein that you've got.
Well, the Avastin's looking for those cells that hide, you know, that they're lurking there. That's what the Avastin does. It's a follow-up. It's a cleanup, so to speak.
Targeted therapies are specific to individual cancers. So different targeted therapies are used in different cancer treatments.
Dr. Lemon put me on Herceptin because it's a blocker. It will keep the kind of cancer that I had from coming back, the way it was explained to me. So I would come in once a week for exactly a year and get the injections, and it didn't really faze me at all.
Common side effects in regular chemotherapy, such as hair loss, nausea, vomiting, are the result of cancer treatment going to normal cells, such as to hair follicles and cells of the intestinal tract. But targeted therapy, because it zeroes in on specific cancer cells, avoids those side effects. So someone does not lose their hair or have a lot of nausea or vomiting.
Well, I don't know what drugs he had me on, but he had me on it until in June, and that was my lowest ebb, was in June. I just wasn't doing well, and I had diarrhea. That was the worst thing to have to handle, because I was getting to the point where I was almost housebound. So he switched me over to Erbitux, and that has been just a night and day. The diarrhea stopped, but in side effect was a breaking out of the face. And I said, well, that I could handle with a little liquid makeup. Why, I'm fine. So, but I said, to be able to go and shop and not have my other problem, I said, it's been a relief.
Now, sometimes when the targeted therapy is combined with traditional chemotherapy, a patient will still have those side effects.
From the Herceptin itself, I didn't have any side effects. I did lose my hair. It wasn't from the Herceptin. It was from the chemo drugs, my chemo cocktail, I call it.
Evidently, this drug is working. I'm feeling much better. I'm feeling better than I felt in a year.
If you're not going through treatment, or you have no reason to know what HER2 positive is and what Herceptin is and how new and amazing Herceptin is. You have no idea.